Good morning. Thanks for being here this morning. I'm so glad to have the opportunity to talk to you about the health, the status of health, if you will, in Allen County. I'm Deb McMahan. I'm the Health Commissioner, otherwise known as Dr. Debbie Downer. You'll understand by the time I get at the end of this presentation. You're going to see a lot of redundancy, I think, throughout the course of this morning's presentations, but I hope that redundancy really creates the impact that we need to change. First of all, I just want to make sure we're all on the same page in terms of thinking what health really means. I think we show a lot of data on outcome metrics, we show a lot of vital signs and BMIs and percentages and stuff, but really health is really not just the absence of disease, it's really a state of well-being. And that state of well-being really allows us then to realize our potential, realize our productivity, both in the workplace and at our school desk, but also in our relationships and in our community. And so I think it's really important when we think about health to really think holistically and think about what that really means. And I love this quote by Benjamin Disraeli that the health of the people is really the foundation upon which all their happiness and all their powers as a state depend. And that really is true. And unfortunately, some of us don't really realize that until either we lose our own health or somebody around us really becomes seriously ill. And then we realize just how important that is to the day-to-day functioning that we have. I want to talk a little bit about the practical implications of health, because oftentimes I think we think of health and we don't really realize it really is the foundation upon which everything, business, workplace, school, all of this stuff, it really is based on healthy people. So talk a little bit about just the practical implications of being healthy or unhealthy. According to the Integrated Benefits Institute, poor health costs employers $576 billion annually. As you would expect, a lot of that comes in terms of direct costs for insurance and health care and procedures and all those things, but a lot of it is just a result of people not feeling well and still going to work, still showing up, but not being productive. The vast majority of money is really lost in lost productivity. But it's really important for children too. I think sometimes we forget that children need to be healthy organisms sitting at that desk to be able to learn. We're asking kids to learn a lot these days, and we really need them to be physically, mentally, socially, spiritually healthy when they're sitting at that school desk. Because there have been multiple studies that have shown that unhealthy children have a very difficult time paying attention in class, learning in class, staying in school, behaving in school, and doing all the things necessary for them to be good learners. The other thing is that unhealthy people don't work. We actually have the lowest male labor participation rate ever. This is not economically sustainable. The vast majority of these people are not working because they don't feel well. Either mentally or physically or some other reason, they're not working. But again, this is not economically sustainable. Unhealthy people can't work. Disability. We have more people on disability than we ever had before. And the problem is disability, as we know, will be insolvent in 2027. And all these people are depending on this to pay for their day-to-day expenses. Again, unhealthy people don't work. So how are we doing in Indiana and Allen County? How do we fare? Well, you already know, they already gave me my thunder here, that we're not doing very well. But let's look a little bit about this. We're 38th. Now, I admit I'm a little bit of a prideful person, a little bit of an overachiever. I'd like to at least be in the top 10. I don't have to be number 1. But really, we're in the bottom 25% of states in terms of overall health. That's really bothersome because this is a ranking that comes out every year. Every year they're asking me, what do we think about these rankings? Well, it's disappointing. It's very disappointing that we rank 38th in the country in terms of overall health. And this, just in case you didn't get the number, this just shows you graphically. We're not in the dark blue yet. We're not in the bottom 10. Please, 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 let's not devolve into the bottom 10, but we're close to it. Mental health, we don't do any better. We are actually 45th in the country in terms of mental health, according to Mental Health America. And we've actually slipped. We were 19th, and we've devolved into 45th. That's not good. That's not good at all. So why is our health so poor? Why are we always achieving these kind of rankings? Well, as they said, obesity. And that's a national phenomenon. That's not unique to Allen County. We just do it better. We just, unfortunately, do it better. 30% of Allen County residents are considered obese. 30% are overweight. A lot of that is because they're not exercising. We don't have enough infrastructure here for people. We have food deserts here, even in Allen County, so people don't have access to healthy foods. And unfortunately, what follows diabetes, or what follows obesity, is diabetes. And diabetes is very expensive when it comes to illnesses, chronic disease. And obesity is expensive. It's another very expensive illness that people, even though people don't usually die of diabetes, it's something that requires a lot of money to keep them going. And when people have peripheral neuropathy, it's hard to work. When people have blood sugars out of control, it's hard to work. So again, it's not only expensive, but it affects that productivity we've been talking about. Smoking. I show this slide because you can see it shows over time smoking prevalence. And what I think is unique about this is that for some reason we didn't get the message. You notice our color didn't change from 1998 to 2008. For some reason we're still smoking at unusually high rates. And I'm not sure why that is. I think most Hoosiers are pretty bright, but for some reason we're not getting the message. Obviously we're about 20% of Hoosiers smoke. That's not a good thing. Of course, you all know how expensive that is. It's hard to imagine that 20% of Allen County adults pick up a package every day that says right on the side of it, this is probably going to kill you, and still smoke from that. That speaks to how addictive nicotine is. We're 41st in terms of smoking, and 22% of Allen County residents, adults, still smoke. But sadly, it's not just adults. Our kids are starting to smoke. And what's really fueling this is the e-smoking. For some reason, people think this is safer. It still has nicotine in it. It's still addictive. And when young people start smoking at an early age, it's much more addictive because their brain is still forming. So it's even more addictive. And I don't know if you recognize, this isn't a jump drive. This is a Juul. This is what kids are using now to smoke electronically. And they can do it in school. They think it's really funny because they can do it and the teachers don't know what's going on because it doesn't create the puff of smoke. This is bad. This is really going to increase our smoking rates because most people evolve from e-cigarettes back to tobacco, traditional cigarettes. You're going to hear more about that later, I'm sure. Infant mortality. We have the highest rates in the country. Allen County has the highest racial disparity rates. And some of these things we can't do anything about, but some of these things we can do better. But it's going to take a good public health infrastructure, a good blend of the private and public sector working together to be able to solve these very expensive crises. Opioids, you've all heard me talk about that. And this just shows you that this is not a worldwide problem. This is not a global phenomena. This is unique to the United States. We represent 5% of the world's population, and we consume 95% of the painkillers. That's not good. And you can see we do that exceptionally well in Allen County. We used to write 109 prescriptions for every 100 people. You do the math. We're down now with the new prescribing rules that went into effect in 2014. Our numbers are much better, but still, we've left a number of people addicted to these medications. This is a ratio created by SAMHSA. And what they did was they looked for every one death you have from opioids, which is a big deal, obviously. But there's a lot of other things that accompany that as well. Treatment admissions, ER visits, people that are using them inappropriately. They haven't gotten to the point where they're actually addicted yet, but they're using them inappropriately. When we looked at our 2016 numbers and looked at that same ratio, we could have up to 50,000 people who are using opioids inappropriately in Allen County. That's a big deal, and I'll tell you why. There are two populations that are affected. I think sometimes when we think about drug disorders, substance use disorder, we think, oh, it's those people, that started when they were very young, usually as a result of adverse childhood events, trauma in their childhood, or being exposed to it from their parents during their childhood, and they started on pot, and now they're on heroin, and they're not working in an abandoned house. And certainly we do have that population of folks. But there's also this population, which I think is much larger. And those are the people who were started on these medications for legitimate reasons. They had a peripheral neuropathy, they had spinal stenosis, they had surgery. And unintentionally, these people became addicted to these medications. These people would be horrified if they knew that you and I thought they might be struggling with addiction, because they think they're just managing their pain. But these are the people that are also accidentally overdosing in our community. America, as you would expect, because we have the most painkillers, we prescribe the most painkillers, we have the highest death rate, drug death rate in the world. But actually that's happening here in Allen County at record rates. In 2016, we had 804 non-fatal drug overdoses. In 2017, we had 1,200. Fatal drug overdoses, 68 in 2016, 127 in 2017. And this just shows you that, does anyone know what happened in 2014 that would cause this big spike in overdoses? What happened is we implemented new prescribing rules. The DEA and our local law enforcement and the Attorney General shut down pill mills. What happened is these people didn't all of a sudden go into treatment for addiction. They went to the streets. And the drug dealers are more than happy to accommodate these people by providing heroin. Unfortunately, they lace it with fentanyl. And this is what happens when people who start on prescription opioids devolve into taking drugs from the street. This just shows you there's not a zip code to look at. This is affecting everybody in Allen County, all areas, all demographics in Allen County. You can see our drug poisoning death rate in 2015 was higher than not only Indiana, but the national average. And this is a shock. This should scare you, because this is the number of deaths. Look at how this has increased over time. 127 people died accidentally in 2017. They didn't intend, this isn't a suicide, they didn't intend for this to happen, they just took too much of the wrong medicine. And again, in 2013 and 2016, more people in Allen County died of an accidental drug overdose than from a motor vehicle accident. And these are young people. These are not old people who've given the best they got. These are young people. Who's going to take care of their family? Who's going to parent their children? Who's going to pay for Christmas? Who's going to keep them in housing and take care of their children? Who's going to pay for this? Who's going to work for you? Because these are young people that are dying prematurely. And this cost, Fairbanks did a great study on how much this cost our state. It's in the billions from people dying. This is costing billions of dollars. Most of these people who died in Allen County, we've been very blessed to be able to partner with the coroner's office and with our Fort Wayne Medical Education Program, and we've analyzed, we have 10 years worth of data, and the vast majority of these people who accidentally die of a drug overdose are employed. These people are working, they're taking care of their families, and now they're not there. Who's going to pick up the slack? Many of these people could have been saved because they died in the presence of somebody. But we have such a stigma about substance use disorders, such a stigma about mental illness, that they don't ask for Narcan, they don't have it on hand. 294 people, 294 families could have been saved if they just had access to Narcan. More Americans died of opioid overdoses in 2016 than died during the Vietnam War. That's pretty staggering. But along with overdose deaths, a lot of other things come when people devolve into a mental health and an opioid crisis. And that's where we are. Make no mistake about it. We are in a public health crisis when it comes to mental health issues. Along with that comes trading sex for drugs. In Allen County, our STD infection rate is so high anymore. And I don't know what to do with these people. We have people who are trading sex for drugs, people who are working as prostitutes with STDs, and people are going to visit them, and we can't do any trace back to find out because it's all anonymous. We have hepatitis C. We have record infections of hepatitis C in Indiana. We have HIV, look at the color in Indiana, record infections of HIV, and these things are expensive. I just did a quick analysis of one cohort, 1 year in Allen County. If just some of the people wanted treatment for Hep C, it'd be $10 million. Who's writing that check? You are. You're writing the check for that. HIV cost $500,000 for a lifetime of care. Who's writing that check? You are. Why is our health so poor? Because we don't fund public health. As I mentioned, we rank 49th in public health funding. And 50 is bad. So it's not good to be in the bottom part. We're 49th in terms of what we want to spend, what we choose to spend our money on in Indiana on public health. The average American spends $232 per month eating meals prepared outside the home, fast food, restaurants, etc. About $3,000 a year. In 2017 in Allen County, we spent $13.71 per person on public health. You can't even go to a movie for that. Why is our health support? You get what you pay for. Honestly, you get what you pay for. $13.90 is what we paid. And the thing is, we know there's been so much research out there that should be influencing our policy because we know the return on investment's there. There's so many examples: vaccines, HIV prevention, Tobacco cessation, substance use, we always know there's a return on investment. These are not just a waste of money. Their studies are out there to show what works, what doesn't work, and what's cost effective. But we have to invest in it because we are devolving into a chronic crisis mode. So in summary, we're in the bottom 25% of states in terms of health. We're 49th in terms of public health spending, and our health outcomes are consistent with those two facts. Thank you. One last comment. I love this picture because I love this picture because it's so telling. It's a great road, isn't it? You probably can't see it from there, but there's one little tiny pothole in there, but otherwise perfect road. Great demarcation, perfect, smooth, but it's going nowhere. I don't want to represent this picture from a public health perspective, from a community perspective. We need to begin to take this seriously.